So I'm going to be chairing the second panel, which is looking at the disease surveillance, but not from the etymological perspective and the modeling opportunities discussed by Kate Jones' panel, but we're going to be discussing the real-world challenges. How do you really do public health response in the real world, using or trying to use technology, and what the challenges and opportunities are? So we have a stellar panel again, and I will start with introducing Aisha. You have heard about her already. So Aisha is a PhD student of mine who has been working on the MIWA project, developing the IoT technology. Do you want to say a few words, Aisha? What has your research achieved? She's practicing for her Viva, so let's give her applause for being concise and answering the question what your PhD is about. And then we can maybe say how IoT plays a pivotal role in sensing for vector-borne diseases and the environment.
Yeah, so basically, as Patty said, I'm a PhD student, hopefully finishing this year. So my background is software engineering and computer science. So this is kind of my first experience moving to a digital health and digital health solution. But I think the inspiration coming from I have also working satellite industry, IoT, image processing. So this is also bringing me where we can apply these solutions. So I worked, my main core of the PhD is more about developing intervention tools, or more digital intervention tools in our case study, which become mosquito surveillance. So it's kind of how we bring these, you see in the first panel, most of the discussion was, there's a lot of technology, but the question is how to bring this technology. Is it really valuable? Or even if you developed a very amazing digital intervention tool, how are you gonna integrate it within the local system, within the government system? That's bring a lot of challenge then. So it's kind of a mix between two parts, is designing the intervention tool, implementing the intervention tool, and then deploying the intervention tool, which I would say it's the most hardest part when we talk about the digital intervention. So even the design, you need to be on ground with the people, you need to be involved within the community, you need to be have a close collaboration with the agent, for the environmental agent, which we have. I think we were lucky to have this kind of collaboration. So we managed to have two collaboration, actually, one in Brazil, specifically in Recife. That's actually at least the one I'm involved in. There's a lot. The project is the scope of project is much bigger, more cities, and also in Madeira Island. So these two areas where my PhD more focus on. Yeah, I think that's it.
So thank you, Aisha. So do you think she would pass her answer of your question on the Viva? What is your PhD about?
I think Diana want to challenge me, but I'm ready, that's fine. I just finished the chapter of the mobile and the digital information.
Eu falam português também. Na panela você tudo português brasileiro. So let's try to speak Portuguese because the rest of the panel are all Portuguese speakers from Madeira or Brazil, or maybe stick to English. So our next speaker is Jailson, who has actually visited one of my previous digital public health conferences in London in 2017, when you were still the Secretary of State in Recife, responsible for the previous pandemics, the Zika outbreak. So do you want to introduce yourself and say how you came to this panel and this collaboration, and how you would see the real challenges in implementing these technologies in the real world are?
Well, thank you so much. It's really a pleasure to be here again. And I think the short answer is it's difficult to know why I'm here, but I guess it might have to do with a combination of having a science background. I did a PhD in Liverpool University and in medical microbiology, studying meningitis. There was actually lots of interesting studies on forecasting meningitis in Africa, but then my study was on pathogenesis. But then when I went back to Brazil, I joined the Ministry of Health first as Director of Science and Technology, and then for 8 years and 2 international emergencies, Zika and then COVID, I was the Secretary of Health of the municipality of Recife. So, and then those two challenges together brought sort of a view of what happens actually when we try to implement and deploy technologies in the field. So I've selected a list. I have 4 minutes. So 4 main ideas. I think we need to talk about, even though it may be repetitive, and we need to talk about inequality, because in the end, some of those interventions may or may not work because the people and the communities may be less prepared or more prepared to respond to that. So I think that issue, and it's one of the most important and pressing issues that we have in health worldwide. Recently I was interviewing Professor Kate Pickett from the University of York, and her book with Professor Richard Wilkinson on the spiritual level. So inequality is bad for everyone, whatever you are at the richer end or the poor end. Everyone suffers for that. And of course, we live in a time of transitions. We have the climate change and climate transition. We have the demographic transition of countries like Brazil. We have a transition in terms of economy, and the transition in terms of technology, which is also, neck-breaking speed. And as we speak, new technologies, new approaches, and actually disrupting technology have been just in the pipeline, outside of the pipeline, in the last few days or weeks or so. The second main idea is, so inequality in these times of change, how can you think about technology to reduce inequality? So it needs to work for and not against that trend. So the second thing is about Brazilian health system, and we had the Brazilian health system, which is to some extent inspired by the NHS. And that was the kind of our shelter in times of storm. So, our message to the environmental and climate people who are here. So it's tried to we had storm, for instance, both at the Zika and now COVID. We had political storms. Like sort of the perfect storm, with a problem at the federal government, huge crisis in the chain of command of response. So all that should be in the equation, if you wish, when we are talking about intervention in the real world, and we need to talk about that. So, of course, we have issues of coverage, overburdened workers, and information systems. I worked in the Ministry of Health, and they have all the boxes, the different departments, and each one of those created a different system, information system, that of course don't talk to each other, and then it's an information puzzle, and it's so I think any technology that integrates to the effort to have in primary care and in surveillance should be on our radar. But the third thing I would like to bring is actually the decision making in the policy level. Actually, there are different steps. You first develop. You have a problem. You develop a solution. You test it. You pilot it, and then you try to scale it up. But then the timing of and the sort of wavelength of thinking of political decision makers is different from researchers and from academia. And I think we have more translators, sort of midfield people who actually can connect the two areas. And there is a term for that, which is translational epidemiology. So you take the epidemiology data, but there is science on how to create narratives. The storytelling and bring it as storytelling and narratives and visualization of data, so that decision makers can make decisions. So, in this case, for instance, to have a good database to feed the large language models is interesting, because it's needed as a prerequisite for the model to be able to be tested in the different scales. So it's a kind of brings about more complexity to this kind of issue. So lessons learned from Zika, and just briefly to say that, when we responded to Zika, to COVID, and for many weeks there is a group of mathematicians that have never met from São Paulo University, who described that Recife response to Zika at the very beginning, when the challenge was in the level of uncertainty was really, really high, was the best in Brazil. And actually, they used to be they used to talk about New Zealand as the best response, but then they decided to say, well, let's bring some different and closer to Brazilian situation. So why I'm saying that? Because all of that was only possible because we had a previous experience facing an emergency that was Zika, and the lessons were there in the team. So of course, when the team changes and there is no, longer term preparedness culture, then it may fade away as we speak. And then I think that's pretty much it. And to say that there is there are interesting opportunities to sort of the VIP network, epidemiology, WHO houses a epidemiology network in people who are trained, have a set of tools to translate those evidence into policy. But from policy to practice, that's also, a lot to be done. So I'll leave it there.
Thank you so much, Nelson. It's great to have someone to share the lessons from Zika, applying it to COVID, which definitely was a contribution why the response was more rapid and successful in Recife, specifically in Brazil. But I think I would like to pick up that you have highlighted two issues. I think the inequality is definitely one of the core part of the picture. Less so in Madeira, which is a kind of a small and quite rich in comparison to Brazil Island. But obviously in Brazil, the amazing work done by the agents, and I'm looking at Georgie at the end of the table, where they routinely visit properties, talk to people, and destroy the mosquitoes in standing water. It's basically annihilated by absolute lack of sanitation systems in some parts of those cities. So if you have open gutters, if you have water running next to your street, which is getting blocked all the time, of course, this is the heaven for mosquitoes. So whatever people actually do in trying to eradicate it and doing the surveillance with visiting the overtrusts and properties would have limited impact unless the city is having the resources and the political power to invest in improving the infrastructure, especially water and sanitation systems. So I think talking to politicians and highlighting inequality as the main part of the agenda, I think is part of our problem, which isn't digital, unfortunately. Otherwise we can solve it, but it's really, really important to generate any kind of meaning for success. So over to Bruna. It's great to have you back on a panel. Bruna is still stepping in for Dr. Pedro Ramos, who couldn't be here, but obviously she represents the ministry in Madeira. So what is your take on this agenda?
First, I will not speak that much in this panel, but to explain
please do. Don't hold back.
To explain a little bit why I'm here also is not only because Dr. Pedro couldn't come, but it's also because I've been working for the last 7 years in giving technical and scientific advice and support to the regional health secretary. And they define health priorities, we define health priorities and policies. And the thing is, I've been working for the last decade in complex interventions for health. And when you work on complex interventions for health in other issues, then you deal with the technology happening and giving you tools to do additional things. So I focused the last years in digital tools for health, and digital health in epidemiology is very important. And it should really be the focus of additional attention from policymakers, from professionals in all levels of levels of intervention. But I think also that it should be important for every sector of the society. We have been discussing how health should be in the center of decision when you are dealing with all the problems in the society. And if that doesn't happen, we will have impacts on health that are not accounted for previously. So digital health for epidemiology is really important to allow us to understand and define the intervention and to have more effective interventions. As we discussed before, we haven't reached much of effective interventions when we are speaking about vector-borne disease, for example. So we believe that we need to have additional tools, because we have seen the appearance of notification systems all over the countries and the world. Data are every day more available and about diseases, but there are a lot of factors that are not considered. We cannot talk only about number of deaths and number of cases of disease. We need to be able to have tools that integrate data from different sources and different sectors of the society. And that, I think, is a priority, and we think it's a priority. We have been dealing with this, we have been thinking about this problem, and our focus now is on developing knowledge and doing the needed knowledge transference that we have been talking about. We deal also with limited resources, and that is a problem everywhere. When we are discussing in health, resources are never enough, because there are always needs and emergent needs. So we have limited resources, and digital tools, digital resources are an opportunity to do several activities in a more efficient way. We have seen it happen in COVID response. Digital came to the table as a solution for many problems, and we need to get this opportunity and to make it useful in other areas. I think that is really a priority. We need to have the lesson learned from the COVID. I think that everyone was worried about that, not to lose this opportunity, but the worries are always decreasing when time goes by, and time is going by. I'm again here saying that it's important to focus and to use this opportunity to enhance our success in digital health surveillance.
Thank you. Thank you so much, Bruna. I think in the first panel you mentioned that we are kind of reactive, not proactive in our approach for preparedness and response, and I think that's absolutely true. So the longer it is since COVID, the less people are caring about hand washing, which I'm sure all of us were washing hands every day before and after every meal, right? Which is obviously fantastic, but that's the same. You know, your example about people in Madeira being really kind of spot on looking after standing water during the dengue outbreak 10 years ago. Now it's a past. It's something people don't really worry about anymore because the danger is not imminent. So I think finding out ways, which could be technological or community engagement, where we keep the kind of importance and keep things on the agenda, both community, political, research level. That's, I think, one of the major challenges. And that's, I think, we not just in this project, but in general, kind of keep failing. But thank you so much for kind of highlighting the opportunity for digital health. So me being a digital health researcher, I love people sharing the passion for digital health. However, it's not the only solution. And there are loads of challenges why and where technology isn't delivering what it could potentially be. So our next two panelists will perhaps bring the technological angle, and they've been actively involved in some of the deployment challenges in the MIWA project in Brazil. So Tiago Massoni is a professor of computer science and engineering, and he is in Campina Grande. He's in the second city where we have worked, and he's been actively involved in both testing the mobile app and the IoT technology. And next to him will be Eduardo, who joined the project last year, representing a research organization, Eldorado. And he comes from the IoT and telecommunications point of view. So he can bring on board what kind of mobile connectivity and other challenges will be faced in the project, which are preventing things being deployed and scale up. So over to you, Tiago.
Thank you. Thank you, Patty. Thank you for your support all through these years. I remember I was here actually 6 years ago. Exactly 6 years ago when the group started, and it was a IRDR event, I think, and we had the opportunity to speak about Zika and the solutions we're thinking about. I'm a computer science professor, so my side of the problem is more of technology oriented, but after I started collaborating with this project and having this experience, I started thinking more about the application of this technology. And digital health is something that really motivated me in terms of how these things will have an impact and what kinds of challenges we're gonna face when we try to use it, and how this sometimes is so far from what we think about when we're only technology oriented. I started one of the things that we actually had the chance to interact with people using this technology. And when you're in the side of the development, it's kind of a shock. And so you see so many things that you didn't imagine. It's like, I'll give you a couple of examples. So I worked with Aisha, and before Aisha, we worked with some of the other developers of the apps. And for example, I remember it was hard to explain that there in Brazil, the agents, for example, for controlling diseases or vector-borne diseases, they were afraid to use the cell phones in most areas of the city because they were getting the devices were getting stolen. So they wouldn't use it. It's just impossible to use it. Other things that happened is that the coverage of the 5G, 4G, or not even 3G sign was impossible. In even if you have a SIM card and you have this working, it's not working in some of the areas because of the coverage. And in this combined with some people, for example, and Aisha is aware of that, we try to put these small IoT devices in the houses of the people, and they were complaining that the power bill was getting it was getting high, but it was like a little Arduino device. It was like
5 volts. Yeah.
5 volts. Yeah. So this is like it's just something that's really hard to address, because it's so different and than we expected. Like in the beginning, when we plan and we establish and design the solutions and just to make sure that you can collect data from the activity, from the daily basis activity. Actually, the technological side of this has some part that I actually learned a bit more about it. And this is the perspective that I tried to bring to the project, is that it's very important to have a very robust and working technology. So this cannot be underestimated, because it's very important to have people trusting the technology, that it's going to work. So if we don't invest much time and energy in actually developing a good and stable solution, people started getting demotivated. And this is something that we talk about a lot. Like this is when one of the agents tried to use like a mobile app, and the mobile app is not working, or it's taking too long to load. They stop using it. They just switch to the old method, or they go to they tend to reuse the old method that was ineffective in some way and it's harder to use, but they are used to it. It's safe, it's comfortable, but it's not effective. So we have to be very aware of the quality of these solutions we are going to apply even before we start. Another thing is that in the political side, this is something that we have discussed it before, is the solution has to work in a small scale first. This is very important. Otherwise, it's going to be very hard for us to convince it's like a higher level government to use it, especially to get funding for that. So usually, as a researcher, we can get funding for studies and research studies, but sometimes it's not enough. So you have to find some other sources of funding, and this depends on convincing politics and people who are in general management, and they want to see something concrete. So it's really hard to convince them if you don't have it. In the logistics and communication side, there's some challenges as well, especially to something like having people dedicated to the project and somebody who's is aware of the differences in terms of legislation and ethical considerations. One example of that is that there was an issue of having data collected in Brazil coming to a server in England. So this is an issue that we have to discuss and see if it's possible, because Brazil has a new data-based legislation, which is based on the European Union legislations. This is GDPR, is it? And it has a number of restrictions. So it's something that we didn't think about in the beginning. So it's something that we have to think about, because we're trying to establish global solutions that will work worldwide, but this tiny details probably we're going to make things much more difficult than we thought. So that's it. Thank you very much.
Thank you, Tiago. So before we turn on to Eduardo, I think the examples you're giving, like people getting worried that this little Arduino 5 volts device gonna double their energy bills, right? And then like being worried about initially accepting it, but then being worried what are the implications for their bills being an issue. We have people who, it's also one case only, who just responded. They just said they don't want the device and checked it out, as opposed to allowing the agents to come around, collect it, and move it somewhere else. Because the logistical complexity of transporting it and sending it to Brazil, going through couple of months of like customs checking in Brazil for these little devices because they didn't know what it was, right? So form filling, which came with it, which our colleagues in Recife had to do. So the people kind of not thinking that if they don't want the device, which is fair enough, it would be kind of sensible to let the project know and solve it in a different way. The other thing which we cannot complain, it was an animal, which Aisha's devices back in Madeira. One of them was in a university, in a garage. And one night, a cane came around and knocked the bucket over. So the overturned water just got out of it, and the devices were running overnight without the water, and they got burned. So we lost one device just because of a poor cat. Of course, we can't blame for it, but these are the real challenges which we have to deal with. So the robustness of the solution and thinking what can go wrong, and trying to prevent it and overcome it technologically or through kind of collaboration and co-creation and engagement, that's really, really important, and that's what this project highlighted. So over to Eduardo, so bring some more technological challenges.
Okay, I'm well known to speak a lot, so I'll try to keep concise, but my background basically is very multidisciplinary. I have a very multidisciplinary approach, and I'll try to bring some light on some specific topics, but I'm a research manager, R&D manager at Eldorado Research Institute. That's a no-profit organization in Brazil. So we're one of the largest institutions non-profit organizations that research things on technology of information and communications. I'm also act as a professor, visiting professor at the University of Campinas in different departments. So as my view is multidisciplinary, so I work with mechanical engineering, electrical engineering, computer science, and computer engineering. So, and my view is always like that. So it's like a noise, but at the end of the talk, it's very likely that you're going to understand what's the view. So I have this international experience in the large research centers. So that brought to me a very good approach that I believe that's good for bringing science and technology to reality. So my view and the view of my institution and the others that I have working with is to try to bring the technology that exists, create new technologies, take this from research institutes, take it from universities, and bring it to reality and create products on that. So, given that, I must state that the reality overcomes any dreams of science and technology. So, I'm starting with the bad news, and then I'll move towards some good news. So another bad news is that we talk about digitalization, it's like a buzzword, it's real. But we have some difference on the technological point of view, because the world that we live, we are analog. Everything that happens is analog. On the other side, the actions are analog as well. In the middle of it, we have this thing with a lot of stakeholders in the middle that we need to create some kind of synapses. I was wondering, because my kid has some issues on the brain. I was thinking about the translation of that issue to real world side. I think we need to have some kind of medicine-like approach to connect this side to the real world on the other side. And that means that we need to fill in all the wishes of the stakeholders until reach the users and the one that is going to buy the solutions. The users are us, and the one that's going to buy is the government, talking about public health. So given that, I'm going to start talking about the technology itself. So the approach that we create products is that we need to have a problem. We need to create a business model. That's everything that we're going to talk here is going to be applied for our project. So given that, we need somehow to bring the right multidisciplinary team. We need to listen to everybody in the right way. We were talking yesterday about it's really nice when everybody's passionate by then solution. But to bring that to reality, we need to overcome a lot of other issues. So, and then one of those issues is that we must take all the over expectations that we have over our solutions and see how we can interact with other multidisciplinary teams in order to create those solutions. So I'm going to give you an example. As I told, I work with different subjects like microelectronics, telecommunications, AI, applied research for IoT in general, for real world. So I was in San Jose, talked with the Cisco guys. That's another bad news. I was in San Jose, talked with the Cisco company. You know, Cisco is the big one. Trying to explain, I'm a Brazilian, explain to them how my IoT solution was about to work with their solution. They could not understand. And then here comes what Thiago said. It's not only the government that wants to see a minimal value product or a POC, a proof of concept, to believe on that. Even the big companies must to see it working in order to understand what you're talking about. Even they are very specialists on the subject, and sometimes they simply don't understand. Okay? So another thing that happens is that we create a lot of data with those solutions, and then what happens is that we believe that the more is the better. So the people that work with computer science believe that the good is the better. So all those data that we have, we must clean up and just take the better part and bring it to the models. Given that, I'm going to start going to the IoT things and the telecommunications stuff. So as Thiago said, we have all that buzzwords around 5G, 6G, 0G, 100G. It's the same thing. Just a brief about that is that we're starting with low data rate, and then when you talk low data rate and bigger latency, and then when we get at the end with NG, we're just talking about larger data rate and a lower delay. So what that has to do with this this process? Because if you do not choose the right technology, and to choose the right technology, we need to have the right people. It's not like we are in the lab, create a very minimal value product, and say, okay, that's the best solution in the world. Everybody's going to love it, is going to adopt it. So we don't know how to communicate that for the next level of this chain until we reach the government. So given that, we need to understand that we need to capture the analog data, digitize it, bring it to the digitalized world, create a nice model with good data, not with big data, and take those things, create a product, bring it to the next level of the chains, that is maybe a company or the government, in order to see if that works and feed back the information for the later level, improve it and make it better, talk with the multidisciplinary team, create the better solution, and move ahead until achieve the government side. So there's a lot to talk, but the main point here is that it's not, we have all the technologies around. I have no doubt on that. All the technologies are there. We have the needs. We need to find the right people to connect all those stuff. We need to feed back the solution and make it better. We need to convince the next stakeholder until achieve the one that's buying, until achieve the government. And that's going to be a way of solving that main technological part. Okay, that's it.
Thank you, Eduardo. I think it's really important that we have all these technologies who actually highlighting the non-technological problems, which are the main challenges to make anything work in a real world. And it would be so much easier if we just kind of did our projects in UCL, get a bunch of students to test it, get the apps running here, or IoT in our lab, and everything would work perfectly well. But like actually getting it out there, even in different countries, in all those different conditions, it is a great fun. It is addressing the real need, but it's a major challenge. So,
if you allow me, I just forgot one thing. That's about the model. The model is not ideally linear. So we have a country like Brazil. We have a city. Within the cities, we have different needs, and then the model needs to cover that. So in order to do that, just to close it, so we need to have as more accurate and bigger granularity. So we achieve that using IoT device and create layers with the satellite information. in other areas until we have a very nice model that feedback by the real analog digitized data. That's okay.
Absolutely, absolutely. So we have the last speaker in the panel. So it's my real pleasure to welcome Georgi Wellenberg, who is an agent. So he's not a researcher, he is an agent whose job is to actually do the real surveillance and use those mobile apps, as opposed to the paper forms, which you have been using for years. And he's been instrumental in working with our team since the first projects in 2017, and really advising on how the app should be developed, teaching us what they actually do when they do surveillance of mosquitoes, and how complex the swarms are, and how they can tell from the larvae, which one it is. So it's been really educational for someone like me. And I would like to thank you, Georgie, for being so committed to the project, even though it's not directly kind of your research agenda. And we would love to hear from you where you think the technology can help, but what the challenges actually are.
Hello, everyone. I am George Wellenberg, and I'm pleased to be here to talk about our experience. And I'm going to read. Ladies and gentlemen, I always wanted to say that. Greetings to the esteemed audience and faculty members, researchers, professors, and students of the University of London. I extend my warm regards to the researchers, professors, and other Brazilians and Madeira Island colleagues present here today. It is an honor to be here today to share with you the progress and challenges faced in combating Aedes aegypti and arboviruses in Brazil, especially in the context of our work in Recife, our city. First and foremost, I would like to express my gratitude for the opportunity to participate in this international workshop, for the ongoing support of the global scientific community in our fight against these diseases. As many of you may already know, Brazil has been facing serious challenges in controlling Aedes aegypti and preventing arboviruses. This year, several Brazilian states have declared a state of emergency due to the transmission of these diseases. The numbers are alarming. More than 4.6 million cases of dengue, with more than 2,400 deaths under investigation, 3,600 probable cases of Zika, and 170,000 probable cases of chikungunya. This data reveal the existence of outbreaks and epidemics in various locations throughout the country, and Recife, we almost had the same scenario in lower levels. In our city, the numbers are equally concerning. Up to the epidemiological week 17 of 2024, more than 5,000 probable cases of arboviruses have been reported, representing an increase of more 500% to the same period last year. The incidence rate per 10,000 inhabitants of probable dengue cases has been above the expected upper limit since epidemiological week 5, putting our city on high alert. Faced with this challenging scenario, it's crucial to highlight the fundamental role of Recife's Environmental Health Program, founded in 2021, in combating Aedes aegypti and preventing arboviruses. This program, primarily composed of endemic agents and supervisors, conducts daily house-to-house visits, providing guidance on prevention and identifying, eliminating, and treating mosquitoes' breeding sites. Furthermore, the program involves a wide range of professionals, including veterinarians, biologists, and sanitarians, and covers the entire city's territory. The environmental health program also combats various other diseases and health hazards caused by environmental risk factors, such as different zoonoses, xenotropic and venomous animals, including animals acting as disease reservoirs, and environmental health surveillance. In 2017, I had the privilege of being part of a working group that collaborated on the development of the Zika app, an initiative of the University of London. This collaboration was crucial for transmitting knowledge about Aedes aegypti control and improving mosquito control strategies. In addition, joint work with the Federal University of Pernambuco and other academic institutions has enabled significant advances, such as the introduction of IoT equipment for analyzing mosquito reproduction conditions. However, despite joint efforts and technological advances, we face significant challenges in fight against Aedes aegypti. One of the main factors in the context of the climate change, which directly influences mosquito proliferation. In addition to that, social environmental issues, such as lack of basic sanitation and housing quality, pose additional risks to the public health. Therefore, it is essential that we continue to invest in public policies aimed at improving the quality of life of the population, addressing not only the issue of vector control, but also the underlying causes of Aedes aegypti proliferation. Only through an integrated and collaborative approach involving governments, academic institutions, local communities, and civil society can we achieve lasting success in preventing arboviruses and promoting public health. Thank you for your attention and for the opportunity to share our experience and challenges. I look forward to continue our collaboration and knowledge exchange in this important field.
Wonderful. Thank you so much, Georgie. Thank you so much, Georgie, and thank you for your effort, because you've been really instrumental in making us understand the challenge and then going through the iterative process of testing devices on top of your very busy work, where you just not just combating mosquitoes, but cockroaches and vaccinating dogs and dealing with all the environmental risks in a very challenging environment. Yeah. And the same thanks go to our Madeira agents who are doing the same work in a sunny Madeira, facing slightly less of a challenging environment in terms of the sanitation and water, but equally demanding job, which really we all kind of take for granted because we only benefit by better control of those vectors. So it seems like, we all agree that tech is great. We all believe in a digital solutions moving us forward. However, have to be very much concerned about the practicalities, such as, availability of network connections, which is not as ideal as it is in central London, as we have encountered in Brazil. Things like, power supplies, not just people being worried about the consumption of their bills, but also, power cuts and blackouts being a commonplace in countries like Brazil, which was another challenge which Aisha's IoT sensors face. Suddenly there was, I don't know how many hours, but a blackout and the devices were knocked over. So kind of things which we take for granted, like power and connection, is not something which is the reality elsewhere. And obviously phones being stolen, or people using very old phones, so the app wasn't working because the phone was just not compatible with the phones we're using and we were testing the app on, for example. But I think we all agree that kind of the non-technological challenges are ever so important. The co-creation and engagement of the end users from the very beginning of the project, not developing bin tech and trying to deploy it without the consultation and buy-in. The political will, making sure the politicians, after we have some local solution which is working, get really understood what this opportunity is. They can take it as their own project and, sell it as their political success, which is often working. And making sure that the potential financial backing will come. as well as the community engagement and a very effective communication with the communities to make sure people understand why this effort is really important. So to conclude, I think I would like to open the floor for maybe 1 or 2 short questions and to see who in the panel would take them up.
Joanna Walker, IRDR. You mentioned lots of the challenges using the technologies that you were trying to deploy, customs, forms, CATs, water, to name a few, but also the advantages of using these techniques. How can you overcome those practical issues? Is it about making the devices more robust? Is that possible? Is it about how you place them? Is it about giving people some way of protecting them from creatures and other things? Or is it really a question of influencing people and trying to explain the importance of doing the work so that they are careful? How can we get around those problems, if it's possible?
Excellent question. So who's gonna take it? Eduardo.
I'm gonna take it. I'm gonna give you the answer with the product development view. Okay. As I told you, we have these technological solutions and the scientific solutions, and then we have the issue itself. We need some medicine to connect that. So the medicine is the right person, the right group, the right team doing that. So sometimes we expect the scientists and the researchers from the institutions, they bring the solutions to the markets. And that's not the truth. The truth, I just told you that sometimes the companies that develop solutions, they don't understand the solution. Then we expect that the government understand the thing that's very complex. So given that, so I believe that the approach that we need to have to follow, to fill in the gap, a kind of bottleneck, is to follow the obvious path for the product development. So what we do, as we have a very large team with very multidisciplinary approach, we must list all the requirements, okay, for the next level of the product development. So and give all the information from the field, all the good expectations, bad expectations of the people that are using that, and apply that to improve the product. So, but we need to create these minimum value products that must be. I don't like to talk about money, but yesterday we have this talk, okay. As I told you, we have the solutions. We are in 21st century. We have all the solutions around. We have a lot of data, a lot of information. But sometimes we just expect that things just go to the market. That's not so easy. So that's why sometimes it's nice to have the industry into the game. But they expect to bring value to them. And sometimes we have 2 big players in this game. From one side, they have the government. That is the one that orchestrates the things and starts the demand. On the other side, we have everybody waiting that demand. But at the end of the day, what the people wait is the funding for that. It's the funding for research, the funding for the companies that are going to develop the things. I'm saying that because that's actually what we're looking for at this moment, to try to leverage the technology. We are not worried about the technology itself, because we need to pay the students, to pay the scholarships, to pay the people to get the big list of issues, and to solve each one by one and go to the next step and create the products. And then we need to take up that IP and move to the next level. That is the product development. So that's the point. So the right people, the right money, the demand, and to create a very systematic way of bringing IPs, intellectual property, and knowledge to the reality. So, and then we have, in the middle of that path, we have the companies that produce the things that need funding for that. It's not like the COVID. Now, as our colleague here said, we have this issue that regarding mosquito, that when the mosquito comes, we have these actions, okay, and then suddenly disappears. We do not have the continuity of that. So in the middle of that, we need to create the solutions and create products and to deliver to the government to some companies. But we need to follow the product development approach and get all the feedbacks and improve that product. We must forget the science at that time, because the science already gave the base for developing things. So I think the product development approach is the reasonable way. And then we need to add those ones that develop products into the game also. Okay, that's
So thank you so much, Eduardo. You effectively answered my last question. I was about to ask all the panelists, is like where you think the major challenge to overcome this is. So product development, a buy-in by the company, getting industry involved. I think this is one of the key things. And this, as you said, will unlock the funding sources. Yes. So can I just ask all the panelists in a couple of sentences to say what do you think is the major opportunity and major challenge to overcome it? And I think Jalson has been looking at me, so he will go next.
Okay, just actually to add to the product development point of view, I would say that spending time discussing and engaging the community and so that they can accept the intervention, they can actually understand why it's there, and it's you have to invest time and you have to really engage the community, and that's not easy to do. And sometimes when you come from a lab or technical or technology background, it's difficult to understand that. Still very important bit of action, which is to have people engaged. And I remember yesterday we went to the Pump and John Snow pub. And why is that important? Is that because I saw the original map of John Snow, the sort of the moment the epidemiology was created in the cases of deaths due to cholera in London. And then I remember that in the first few weeks of Zika crisis, we did exactly the same. We had pins in a map of Recife in a wall, but the point is we were doing something about it because it was there in kind of the very high decision making for the local government to act, and I think this reminds me that not only the agents need to understand and they need to have the feeling of that data is theirs as well, and I remember that when we had the first primary health teams going around and mapping the areas of, for instance, most vulnerable people in the communities, and they actually draw it in a cartolina. It's a kind of a large piece of paper, and they would draw it, and it was funny because some of the drawings were horrible, some of them were pieces of art, but there was a kind of a sense that was non-digital, but that belonged to them and that they had a responsibility on that territory. So I think when we think about digital solutions, which can speed up, scale up, and we also need to think about not only to be simple to use, but also from the start to think about giving back and the sense that they can use it for their own work. So maybe that would help reducing resistance. I think both are relevant challenges.
Absolutely. I think the co-creation could be seen as just involvement in creating the technology, which will feed the beat. Yep. But also the usage of it, I think, has to have this kind of loop back where the data is being shared, or there is a way of explaining to the end user, in this case the agents, why it is important to continue using it and how they benefit. So thank you so much. So who's going to go next? How, in a couple of sentences, you would solve the challenge of the technological.
Maybe concluding as well the whole 5 years PhD, almost 5 years. So I will summarize the whole things is like in more like a questions. So the first question, do you really need intervention? Do you really need a digital intervention? That's the question. It's not like because digital is doing a lot and then I have to bring a digital, then you have to think about it first. Is it really this case study or this overarching goal will not be achieved without digital solution? That's the first thing you need to think about it. If the answer is yes, then there is like a big model you have to look into it, where the digital is just a piece of it, and then there is a lot going around. So if you don't have great like planning, strategy, communication, one of the barrier, like at least for me, was the communication. So having someone in like middleware translating, even like within the focus group with this stuff, sometimes like as a technical person, like there's a lot you say. It's mean a lot for you as a developer, but like when they translate it, they missed a lot of stuff, which is very important for you. So do you have the communication skills? So then it's coming from strategy, planning, communication. One of the things, if I go back, I will do it, is the pre-assessment for the field. So I will not take my intervention to the field without a pre-assessment. So, for example, they will say robustness, like, yeah, there is a robustness. I have the best digital solution. It's like robust, great, whatever. But once you go to the field, small thing, the spatial distribution, the spatial of your intervention could not fit in one of the houses. For example, I have two settings, like Madeira and like Brazil. if you told me like there is a big difference, the way I see how the pilot could be run, or like a digital intervention could be adopted in Madeira compared to Recife. If I go to Nova Descoberta, which is the neighborhood where we do our actually IoT and this stuff, the way I see it is my digital solution will not solve the problem. What I see in the ground, it was like more water and sanitation issues. So I think here this area is not more like, this is the people who can help, can bring something, not my digital solution. So it's depends. The settings is making a big difference. The group you are working on. One thing before, I'm not sure, maybe this is like a closing thing. The best person, there's a lot of collaboration, there's a lot of copy, there's a lot of postdoc work in the project. But without Georgie and his team, nothing can happen. So if you don't have a direct communication with the environmental agents, if you don't understand them, if you go like, again, culture, one of the things like very important with the Brazilian culture, as even with the Portugal, maybe like less, you need to have a very like good communication with them. You need to be like in contact with them all the time. That's like kind of engagement. So if you lose the engagement, you lose the project. So there is like how the summary for me, there should be a model. You put it and you put your digital solution here, and then you put all the things around it. If all these things doesn't work, your digital solution will never work. So that's how we see the output of like these two settings with two interventions as well. But you need the environmental agent, but you need someone like policymakers, someone from the government, someone from the municipality level. That's the people who will help the community health workers. So they have a lot, the workload of the community healthy worker. Nobody will talk about it. When I went to Brazil, when I talk with the agents as a friendly talk, the workload they have is a lot. The things they are handling within the community is a lot. So this is like, if you're bringing your tools, okay, they are happy to support, but then the workload needs to be taken in consideration. Who's gonna help them is the municipality level, is the local authority, is the government. So we need to have this big collaboration, direct collaboration with the municipality or the health authority, and then come back to the small scale, which is like neighborhood, not even like don't go to like make it a large scale. Neighborhood will be enough to like to prove your proof of concept. So yeah, that's the outcomes of these three.
Thank you so much, Aisha. I think it was really eye-opening to be installing, high-tech IoT sensors in Nova Descoberta. So okay, so is it a burning question, right?
Yeah.
Yes.
Sure. Very good.
Absolutely. I think the challenges have been, as much part of your achievement as the technological solution.
The final chapter is sorted. Yeah.
He's telling me exactly.
There's the recording. You can watch it and write it.
Right. Yeah. So to conclude the panel, so the remaining panelists, do you have any burning issue or suggestions how the technological solutions could be overcome in one sentence?
I'm going to be very fast, but I must agree with Aisha and disagree at the same time. I have no doubt that technology and science can bring the solution for the problem that we're talking about. But we're talking about a complex problem. Complex problem is surrounded by small solutions, but in the middle of it, there is the communication itself. It's mean, I read something in the Waterstone today that's resume what we're talking about here. That a smile is the thing that makes the solution straight. So we need to have the right communications with all the stakeholders and make it easy for everybody, not only for the ones in the borders, but for everybody, because that is the main issue in the complex project. So it's a communication issue. Okay.
And I would like to agree with Aisha also. She was with us in Brazil installing the IoT equipments. And as I used to say to the agents, how can we work with digital solutions in a world that is changing? The world is changing every day. And how are we working with papers in traditional mode if we have artificial intelligence in the world at the same time? The artificial intelligence, some people used to say, that's threatening our jobs. And we are still working on paper. And I try to make the agents aware of the situation of this problem. And I think the digital solution must be easy understanding for the agents, not only the agents, but also for the people. And we have lost so many data, important data that could make us understand these diseases today, from the beginning. A lot of million of data, and we cannot accept this anymore. We have to change everything, and our efforts must be every day. Not only the politicians, but the managers, but the agents and the whole society. That's why I think our efforts, we cannot feel tired of struggling. That's what's happening with us in Brazil. We are trying to develop an app as the same of Zika app in Recife, and we are struggling because of all the situations that was spoken here today, like internet connection, the device is slow, and we are trying to overcome these issues, these problems, but I think we must be in the right way and never stop and never give up.
So thank you for suggesting us to never stop and never give up. So, Bruna and Tiago, you didn't have a chance to have your final sentence.
It's just it would be nice to wrap it up with your phrase. You can repeat it later so we can finish. But it's just two things. I think assuming that the answer to Aisha's question is yes, we need a digital solution, or it's good to have a digital solution. We have to find a way to make this to extract the core of this solution, which you will be working everywhere. It's like what is common in every place that's gonna work. It's like what are the assumptions we can have for every place, and then work on the details. So every place we're gonna apply this will have some similarities and some differences, and we have to map the similarities and differences, because this will make the development of the solution possible. Otherwise, it's going to be like impossible to develop a different solution for every place. It's happening in Brazil. In one state, we have like 200 cities, and each city has a different way of treating the mosquitoes and diseases, and so we have to find a way to find out the commonalities, and then try to establish a way to develop the differences in a more straightforward and feasible way that we can actually make this problem manageable. Without that, it's going to be very hard to make something workable in a medium or longer term. Okay?
Thank you so much. So I think what Diana said, one-fit-all approach doesn't work. But the opposite, having each city doing their own thing, doesn't work either, because the interoperability, harmonization is impossible. So over to you, Bruna. So last call for action in a couple of sentences.
Just a thought. After Aisha spoke about her experience on this matter, I think that she made us think about prioritization, priorities in public health. I agree that digital solutions are not always the solution. But I think that development has to be done after an assessment of needs. And you have to describe needs in Brazil, needs in Madeira, needs everywhere. We need to know what are the real needs. And I think that's the basis for developing meaningful, simple, and accessible tools. I think also, again, that ambitious business models have to be part of the projects. We have to have the next step prepared. Otherwise, we won't be able to do what we want, is to help people in the intervention doing their work. I also believe that marketing communication is very important, and we talked about that. And again, the information has to be passed on. Technical information has to be published, not only in papers, but also has to reach all levels of the professionals involved. And I think we should also target that. I think that your center does that, tries to do that, and that's also something that we should do. And I think that we should focus in communication to the public, so that we can also have their feedback in this process of development. It's not only the feedback from the professionals at work, but also the public. So if we hear them, we will find better tools and better solutions also. Thank you very much.
So thank you so much, Bruna, for the last call. I think I cannot agree more. And I would like you to join me in applause to the amazing panel.